You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that have been diagnosed with periodontitis. If you have bleeding gums, red swollen gums, bad breath, or loose teeth, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with gum disease. My first guest is Dr. Alice Moran. Dr. Moran is a board-certified periodontist, and she has a practice in South Orange County. Dr. Moran, welcome to the program.
It's a pleasure to be here. Thank you for having me.
Now, first up, before we get into today's topic, you don't look like a dentist. Do you hear that
Yeah,
a lot?
I do. Not as much now as I used to years ago when there weren't as many women dentists.
Okay, now why did you want to become a dentist? I always ask people when they come on the show.
You know, when I was in high school, I was looking for a part-time job, and one of my girlfriends worked for the local dentist. And then unexpectedly, she had to move, and she asked me if I wanted to take her job. So I just sort of fell into it. I was only 14 years old, and I loved working for him.
You were a hygienist as well.
Yes, so I started out as a dental assistant, and at that time I knew I wanted to do something in dentistry. So I never met a female dentist before, so the options at that time would be either become a dental assistant or a dental hygienist.
Was it rare, by the way, when you were in dental school? Not a lot of women in
Not
dentistry?
a lot of women at all. 52 dental students in my class, and we only had 5 women.
Probably had to make you a little tough back then to deal with all those people. You were also in the Navy. You were a commander for over 20 years. Tell me about that.
Yeah, I enjoyed that.
You were a dentist, treating...
Yes, I was a general dentist for 10 years, went to 3 different duty stations, decided I want to get involved in periodontics. Actually, I knew all along that that's what I wanted to do.
Why? Why periodontics?
It's the logical progression to me, having been a hygienist, because treating periodontal disease is what hygienists do. You do also the prevention. You're trying to prevent periodontal disease.
Okay, so gum disease, by the way, and periodontal disease are 2 different things, but do patients call it gum disease?
Patients call it gum disease, and it's kind of blurry where one
teeth.
starts and where gingivitis stops and periodontitis begins.
So loose teeth, bleeding gums, what else? What's another symptom?
Bad breath.
Okay.
The teeth get longer. Remember the expression, somebody getting longer in the tooth?
Do they really get longer in the tooth? Is it the appearance that it gets longer? Because
no, it's because when you start losing gum tissue, you start losing bone, the teeth are actually longer than they used to be.
They start coming down?
Yes.
Now our program airs nationwide, even in Canada. I interview a lot of periodontists. Very few are board certified. You're board certified. What does that mean?
Yes. It means that you have to go through additional hoops.
Okay.
You have to present cases to the board, although the board certification has changed over the years. It used to be when I took it, you would have to treat a number of patients, show photographs before and after, probings. We measure the gum tissue, so they would have to see our charting of the patients. And then after you presented your cases, then they were free to ask you any number of questions that related to your patient or didn't relate to your patient.
Okay.
So they're finding it's too difficult to get these cases because you have to follow up the patients for a year, and sometimes people move and things happen.
Okay.
So now it's become more practical.
On to today's topic, new treatment options for people with periodontal disease. What are the different categories of periodontal disease?
There's gingivitis, which is early periodontal disease. It's when the gums are bleeding because you haven't gotten all the bacteria off the teeth. So 100% of patients, if they don't brush and floss their teeth, are going to get gingivitis. Takes about a week.
So if you don't, okay, what about people that only bleed when they floss? Are there certain people that even bleed when they brush?
Sure, there are people who bleed during brushing and flossing and both. But any blood at all is a symptom of disease.
And that can be turned around. I mean, that's an
and that
easy
can be
one to
turned
fix?
around. Yeah, when you have gingivitis, that can be fixed by good home care, or professional cleaning with your dentist or hygienist. And the catch is to not let that get to the point where you start losing gum tissue and bone. And that's when you start talking about periodontitis.
So periodontitis is what then? What are those symptoms?
What defines that is that you've started to lose bone. In terms of the symptoms, they're going to be really the same as with gingivitis.
So the teeth get loose.
But the teeth getting loose, that means that you have periodontitis.
But why are you losing bone?
Gingivitis.
Help me understand that. Why the loss of bone?
What happens
so the bacteria
is
is getting in there? What's going on?
It happens on 2 fronts. First, the bacteria produce enzymes that destroy the bone. then your body is trying to protect you, and it produces different enzymes, and those enzymes destroy the bone. So you're kind of getting it on both ends.
And that's why the teeth get loose.
Right, because they don't have as much bone. If you think of like a tree in the ground, you know, the roots in the ground, if you were to unearth the dirt around the tree, that's what happens.
So this bacteria,
Yes.
it rests where? Underneath the gum line?
Yes. It can be on the teeth as well, but the bacteria under the gum line.
Now what about severe periodontitis? What is that?
That is when you start noticing increased mobility. At that point, they may start having pain. Typically with early periodontal disease, there's not a lot of pain involved. But as it gets more severe, frequently patients will have pain, but not always, which is a thing to be cautious about, because a lot of times when patients come see me, they say, well, I don't see how anything could be wrong, nothing hurts. And I say, well, you know, it's a lot like arthritis or some chronic diseases, or not really arthritis, because arthritis you can have pain, but say diabetes, certain types of heart disease, high blood pressure.
Right.
A lot of times you feel great and you have problems.
Now we talked on the telephone. You say that a lot of periodontists don't even like, in general, dentists don't like treating periodontal disease. It's not very sexy. What do you mean by that?
Exactly. Well, certain things that we treat in periodontal therapy, you get immediate gratification. Like when we do a soft tissue graft, somebody has recession and you add gum tissue, you can see a result right away. Cosmetic crown lengthening, implants. Some of these treatments, they're the more sexy treatments because the patient sees something right away. Mm-hmm. Unfortunately, with the garden variety periodontal disease that we treat, you don't see the results right away, oftentimes. And so periodontists, frankly, a lot of periodontists have gotten disillusioned about treating gum disease because traditionally we treat it with surgical treatment. Mm-hmm. Patients don't like to get surgery. A lot of patients delay getting surgery or never get periodontal surgery.
You say they won't accept the treatment plan because
Very often
don't
they will
want...
not accept the treatment
plan. Are there gums
plan.
cut in that procedure?
Yes.
Okay.
With traditional periodontal osseous surgery, what we do is we go ahead and we make an incision, we pull the gum tissue away from the bone, and we clean everything out, and then we suture everything back together again.
And the downtime, recovery time for the surgery?
For traditional surgery, it's a few days. You know something was done to you, you're a little bit uncomfortable. Sometimes patients need narcotics to be able to get over the discomfort.
You say this new laser has changed everything?
It's absolutely
Completely.
changed everything. Because the patient is not getting surgery, they can go right back to work afterwards. We either do a half mouth or a whole mouth. Typically, if I do a whole mouth, I'll sedate them so they won't go back to work.
You said they love you because, in fact, I'm quoting you. You said, well, they love me because I give them oral sedation. They don't even know if they have the treatment.
I call them the next day. Not only do they not have any soreness, they don't remember anything. They feel great. Their mouth doesn't hurt. And you have to remember, Randy, a lot of the patients that I treat are dental phobics. One of the reasons they haven't come in to get their periodontal disease treated is because they're afraid of going to the dentist.
Are people still, I mean, do they still tell you that? I hate the dentist. I don't like going to the dentist.
The favorite line the women say, I'd rather have a baby than go to the dentist.
Is that right?
I get a lot of women saying that to me. So yeah, a lot of people are very
You explained
afraid.
to me, when we talked on the phone, that so many people, they've been through so much that by the time they have advanced periodontal disease, they don't want to see a dentist.
Oh yeah, a lot of times they have one bad experience. Frequently it's traditional surgery they had how many years ago, and they know they have problems, and they'll say to me, I just can't do that again.
So do these gum disease patients or periodontal disease patients, they know their options in most cases. They know they need a surgery. And the laser, though.
Well, now I'm getting people coming out of the woodwork, really.
Really?
Because I've done some advertising, and when people realize that it's not a surgical procedure, that there's very little, there's no downtime, very little discomfort. And it gives them an option.
You said they're coming out of the woodwork to do it.
It gives them their life back.
All right.
Because a lot of these people are crippled.
On that, yeah.
A lot of these people are crippled by their periodontal disease. They don't like the bad breath. Maybe they're covering their mouths a little. They don't want to smile because their teeth look long. They have those black triangles between their teeth.
What do you mean black triangles?
Because when people start losing gum tissue and bone, a lot of times when you see somebody smile, it looks like a picket fence. You see all the spaces in between it, the black triangles.
I see.
So people get self-conscious. They don't like that. It affects their appearance, it affects their breath. They may not want to get into intimate relationships. So already it's affecting...
Because of their breath?
Yeah, because it's already affecting their way of life. Their gums bleeding.
On consults, do they tell you that they become very withdrawn?
Sure.
Very shy because of this?
I get people coming in crying, talking about their gum disease. And so up till now, they really have felt like, you know, a caged animal, like they really had nowhere to go.
How many dentists nationwide, by the way, are using this new laser to treat periodontal disease instead of the surgery?
There are 700 dentists that are trained in the LANAT protocol, the laser-assisted new attachment procedure that Periodontal markets.
Okay, as of this taping.
As of today, actually as of today.
And that's what 5% of all dentists nationwide?
You know,
2%, less than that?
Yeah, something
somewhere in
like
there?
that. Somewhere in that ballpark. It's still fairly low.
So I understand this correctly. Okay, so somebody with periodontal disease wants to get it treated. Normally, they go to a periodontist, and you have to cut into the gums and scrape it off.
So no, what you do actually is you make an incision between the gum tissue and the bone, you pull the gum tissue away, and then you take various ultrasonic instruments and hand instruments and you get in there and you get all the tartar and the bacteria out of there. Then you'll also use a high-speed drill like you use to fill a cavity and maybe smooth the bone in different areas, and then you can also do some bone grafting. Now, the laser is
So where's
different.
the stitching comes in, by the way? Because you say there's stitches.
When you're all done, you have to put the tissue back and you put stitches in.
Put stitches.
then
Okay.
you
And
can-
that's the old way.
That's the old
But that old way is still being done today, you're saying?
It is. The majority of periodontists are still doing conventional periodontal surgery. The way the laser comes in, and I got to tell you, Randy, I was very skeptical to begin with when I first heard about this. Yes, I was very skeptical because my thinking was that you would not be able to get to certain areas. That was the thinking, that, you know, when you're doing traditional surgery, you can see very much where you're cleaning.
All
So
right.
I couldn't really get how this whole thing worked, but the way it works is that light will get to areas that you can't even get to with traditional surgery.
With a scraping procedure.
Correct.
Okay.
One of the failures with traditional periodontal surgery, if you think of this, think of my hand as a tooth,
All right.
and the two roots coming like this, say a lower molar.
All right.
And what happens with periodontal disease is the bacteria get up in this area. It's called a furcation, but that doesn't matter. But it gets up under here. When you do traditional surgery, you can't clean that area. You can't
So
get
that
your
tooth root
instruments up in
area,
there.
you're getting in there.
So the laser, the beauty of the laser is it can get to some of these areas that you can't get to with traditional surgery. And that's why we're getting such fantastic results. We're getting regeneration that we haven't even seen with traditional
Now,
surgery.
you say that not all lasers are the same as well.
Yes.
Okay. So what should you look for in the laser?
What you want to look for, if your dentist has a laser, you want to know what kind of laser that is. Only the Periodontal by Millennium, and by the way, I don't get money from Millennium,
Okay.
I'm just giving you the information, but the
Why do you like it?
by Millennium, because they are the only company that has done the research to back this protocol.
And it's FDA approved.
It's FDA approved, and you can see the studies in case after case where they've gotten healthy gums, regeneration, and these other lasers purport to get these results, but they really don't have the science.
So how did you
behind
get
them.
involved, by the way? Because you're treating it the other way with cutting and stitches. You go to a
That's-
seminar, you hear about this.
Well,
What is
it happened on a few different fronts. I travel to some general dental offices to provide their periodontal treatment.
Okay.
It just so happens 2 of the offices that I go to, 2 of the dentists were getting involved with the periodontal. And at first, I have to say, I didn't believe it. I kind of poo-pooed the whole thing.
You didn't like it?
No, I didn't like it at all. And so one of the dentists said to me, you know, you really have to look at this thoroughly. She gave me some of the research. She had me look at it. Well, coincidentally, I was just starting to think about it, read about it, and I was going to my perio meeting. So when I go to my perio meeting, I go ahead and I have my friends who I did my residency with, and we all talk and go to different
the perio
lectures
meeting
together.
is just,
it's an annual meeting
okay.
with the American Academy of Periodontology. So
Sounds
the
like an
last-
exciting meeting, by the way.
It is.
Okay, good.
But anyway, so the last meeting, I'm with my 4 buddies, and that's all we talked about the whole week because...
Was this new laser?
Yes, because it was the first time that they had respectable, renowned periodontist, Dr. Ray Yuckna, who's known all over the world for his periodontal research. They had him speaking about the periodontal. He was the periodontist who helped out with their research. And so after all of my friends and I, we saw him speak, and he was talking about his experiences and said that he no longer does traditional periodontal surgery anymore.
And you said, I got to get one of these lasers?
Then between that and the reading, and though also, so I was telling you about this woman who was telling me that I needed to get the periolase. Well, the next time I went to her office, she wanted an opinion, I think it was for an implant.
Okay.
On a patient. Well, this patient was one that she had done the periolase on. So I saw all her records, I saw the x-rays, I saw the periodontal charting, and I couldn't believe it.
You were surprised?
It was amazing.
At the results?
It was amazing.
Are you surprised now? I mean, you've been doing it for a while?
Yes, I'm really amazed. One patient told me he felt like somebody had just taken all of his teeth out and cleaned them all and put them back in, and that he just never felt so good.
So how soon did the symptoms go away? The bleeding gums, the bad breath?
It seems to be immediate.
So your patients, I mean, immediately it goes away?
Yeah. Now, they shouldn't have any bleeding at all. During the healing period, it can happen because you get a scab on the tissue, a little bit of a scab, so you could have some bleeding, but that's more a function of the healing
So they go to work the next day?
Oh, yeah.
But in the surgery, the way it's being done nationwide, most of the time?
Typically, most patients want a few days.
Couple days on.
Everybody's different, and every surgery's different, but typically people
So
want
oral
a few days
sedation
off.
is what you're using?
Yeah.
And so they don't even remember the procedure?
Right.
I mean, you told me on the phone, they don't
right.
even remember. What happened?
But I get different types of patients. Some patients don't want sedation. They want to be right there and know exactly what you're doing.
Does it hurt a little bit?
No.
No?
I mean, you have to get them numb, so it would be no different than getting a filling done. But again, if you don't like that idea, if you don't want an injection or you're afraid of the injection, we can make it so you're not even aware you had an injection.
I've been told one of the problems with these treatments is the patient is left with extreme sensitivity, gum sensitivity.
That is true of traditional periodontal surgery. They do have, their teeth are more sensitive.
Not with the laser?
Not with the
Well,
laser,
why is
no.
that?
Because the idea is that you're not removing tissue. The reason you get sensitivity is because of gum recession. With
So in traditional surgery, you're actually carving out some of the gums?
You may be, but even if you don't, whenever you lay a flap, the studies tell us you're going to lose about a half a millimeter or a millimeter of tissue. So that's the reason that people have sensitivity. Also,
So what are their advantages? I mean, what are the clear advantages with the laser treatment over the surgery then?
well, the biggest advantage for the patient is there's very little discomfort.
Okay.
They don't have to worry that they're going to be laid up for a few days, and patients love that. Nobody likes having surgery.
Yeah.
Another advantage would be no sensitivity. They don't get the root sensitivity like they do
Right.
with traditional surgery. They don't lose tissue. Well, with traditional surgery, if you have a periodontal defect on a front tooth, and you go in there, we can fix that defect. We can do bone grafting, we can do whatever and fix that defect. However, you're going to lose some gum tissue, and people don't like that.
So the lasers, that's
The
behind.
laser, you don't lose the gum tissue because you're not taking anything away, you're not laying a flap. So particularly for anterior teeth, it's a huge win-win.
Okay, now you are a specialist. You're
Yes.
a periodontist. And we talked a little bit on the phone about this. I mean, you have a certain a bias that you believe that people should go, because I guess anybody could buy the laser. Any general
Correct.
dentist could buy the laser.
Correct.
But you feel that they should see a periodontist, a specialist. Why?
I think it's better to see a periodontist because that's what we do all day. That's what we're trained to do. Understanding traditional periodontal therapies allows you to look at the laser differently
Okay.
than if you're not a periodontist.
No, but does it cost more to go to a specialist
No.
like you?
No, does not.
So ask for a specialist.
Ask for a specialist and ask for the periolase.
So when they go in, do you see them on the console?
Of course I do. I like to talk to my patients. I answer their questions, and I always tell them, I hate that feeling when I go to a doctor and I walk out and I think, oh God, why didn't I ask them this? Why didn't I ask them that? So I always tell them, look, if you have questions afterward, you can call me, email me. I will always answer your questions. And I've also had some patients, particularly laser patients, because they tend to be more phobic type patients. Sometimes they'll even come in and I won't charge them a second time just to talk.
Just to talk.
Because I want to make sure that they're comfortable, that they understand the treatment and that they're comfortable.
Why do you
with
like
it.
this so much?
This is the biggest excitement that I've had treating periodontal disease in years.
Has it changed your whole
It
career?
really has changed everything because the patient acceptance, the knowing that they're not going to be uncomfortable afterwards, it's just really changed everything.
Okay, we're going to take a quick break. We come back, the diagnosis, what they can expect on day one, and just kind of take me through the treatment process.
Sure.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what you can expect when you see Dr. Moran. So again, if you have bad breath, loose teeth, bleeding gums, you've got to watch this next segment. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Hot topic today, a new treatment option for people with gum disease. With us, we have an expert on the topic, board-certified periodontist, Dr. Moran. So, bleeding gums, bad breath, loose teeth, bright red gums.
Right. Although you can have periodontal disease and not have red gums.
Okay.
So red gums is one of the signs, but after the disease has been around for a while, your body tends to scar. And that scar tissue is not going to be as red.
All right.
So because if
So
somebody
bright red gums, inflamed.
Right, but just so people know, over 50% of adult Americans have periodontal disease.
Is that right?
Yes.
And this is an easy treatment.
Yes.
I mean, they go in, the laser hits the area, kills the bacteria, and you're saying the bleeding stops, bad breath goes away. You're killing that bacteria.
Right.
I mean, it sounds simplistic in a way. And
Well,
it is.
there's some maintenance involved,
Okay.
like anything else. I always tell people, it's like changing the oil in your car. I could give you a brand new Mercedes, but if you don't change the oil, eventually the car is going to die, right?
Yeah.
So it's the same thing with any kind of periodontal treatment, that you have to pay attention to the maintenance. So you have to have good plaque control afterwards. That means good brushing and flossing.
All
You
right.
have to see your dentist for cleanings. You have to do everything that you need to do.
And those symptoms go away right away, you say?
Yes.
I mean, in your experience, it's been...
When I talk to patients, of course, I don't go home with them and
Yeah.
look, but when I talk to them and I see them at their week post-operative appointment, there's no bad breath, no bleeding.
Do they give you stories? I mean, do they call me? What do they say to you? I mean, it's all done a week later. That's gone. What do they say to you? I mean, do they...
Oh, best thing that ever happened to them. It was their only hope to save their teeth. Because in their minds, a lot of them, traditional surgery was not an option. A lot of them have done that. They did it 10 or 20 years ago, and they're not going to do it again.
They swore they would never do it again.
And I have people come in and say to me, well, I did the periodontal surgery once, twice. Am I going to have to do this again?
Okay.
And I say, no, not if you do everything you need to do. The whole idea is paying attention to the details.
If this works, this laser, as well as you say, and you're involved in these periodontal meetings nationwide, can't whoever this board is stand up and say, hey, this should be the new gold standard way we do it, rather than the cutting and the stitches?
I think it'll take some time.
Will that happen?
I think that will happen. I firmly believe
I mean, the future
so.
is definitely that.
I think in the next 5 or 10 years, you're going to see this starting to happen. Right now, Ray Yuckna, who's the periodontist who did the research into the Lanapp procedure, which is the laser procedure,
Okay.
he's, I want to say it's at University of Colorado or University of Denver. Anyway, in his program, they're starting to teach the laser therapy, but it's the only one in the country.
Okay.
But
Now,
it's happening.
Now, I've
It
had
will
dentists
happen.
on the show, and I've asked them, knowing I was going to interview you, generally, and that will say, I don't know, it sounds a little gimmicky. And they don't know much about it, which surprised me. So dentists will watch this show because it's a dental topic. What do you want them to know about this laser? It works?
It works. Tell them to do the research, to look at the patients who have had this treatment done. You really have to see it for yourself. And if you look at the research, another big advantage that I don't know if I mentioned is, traditionally when I see patients at the evaluation appointment, what I'll do is I look around their mouth and we make measurements of the space between the tooth and the gum. And we do that at 6 points on each tooth. We record this.
This is the diagnosis
This is
part.
the diagnosis part. And we look at x-rays. Well, traditionally, when I was doing periosurgery, I had to, at that time, decide what teeth I was going to condemn. In other words, if a tooth is only 50-50, do I want to ask you to spend a lot of money to try to save it? Then I'm going to look bad in another year or two if we lose that tooth.
Okay.
Well, the beauty of the laser is I have a lot of these teeth that are 50-50, some that are 80-20, I think they're going to lose them. However, it's no extra work, and we haven't lost anything by going ahead and doing the laser, because we're not paying additional money for regenerative materials.
So you think you're saving teeth?
So in other words, we're saving some of these teeth that we wouldn't try to save before.
So early treatment, like anything else, is much better. I mean, is that your message as well?
Exactly. You're better
Bleeding
off.
gums, do something about it.
Exactly, because the treatment is very easy early on. If you really just have gingivitis, it's reversible. And it's pretty easily reversible. But as you start heading into periodontitis, It's never totally reversible. What we can do is we can get you to a point where you can clean your teeth well, and you can come in for maintenance, and we can get everything clean that you can't clean.
Great information. We're out of time. Final message. Somebody watching this, they're very skeptical. They have the symptoms that you've discussed. What do you say to them?
I would say call our office. Let me do an evaluation on you and see what your problem is. And we have this great option of the Periolase. If you're a phobic patient, we can do oral sedation. You won't even know that anything happened the next day.
Now, what do you give them, by the way? After the treatment, what do they take?
Maybe Motrin. And sometimes they don't even need the Motrin.
It's that...
It's that easy.
So they don't complain about pain? They don't say, boy, I'm glad.
No, I really don't get any complaints about pain. It'll change your life and allow you to keep your teeth.
All right.
Give us a call.
I want to thank you for coming on the show. Very good.
Thank
Great
you.
information. You've been watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, you can visit our website at wellnesshour.com, and you'll probably put this interview on your website as well.
Yes, I will.
And for now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.